Polisitemia is a rare disease and is a malignancy in blood cells that grow when bone marrow produces too many red blood cells. This condition makes the blood go viscous so that the transfer becomes slow. This condition has several complications such as blood clots that cause cardiac arrest or stroke. Symptoms of Vera polycythemia. The Vera's opinion Brugge is usually unaware that he was the disease because the disease can appear in the saline for years without causing any symptoms. In some the first symptoms such as the following may appear: 1. Head pain, 2. Dizzy, 3. Weak, weary, and blistering, 4. The blurry view, 5. Products of excess sweat, 6. Itchy on the skin especially after a bath, 7. Pain and swelling on a single joint, which is most often on the toe, 8. Shock of breath, 9. Ball sensation, tingling, burning chest, or weakness in the hand as well as the feet, 10. Fever. Often, the stomach is bloated, majesty, and full of spleen enlargement. Minor bleeding, like the appearance of bruises on the skin. 13. An unplanned significant weight drop. Diagnosis of Vera polycythemia. Diagnosis is enforced based on anamnesis, physical examination, and support examination. During anamnesis and physical examination, doctor will seek symptoms from disease in the AGV. Then doctor conduct a support examination to assist in enforcing diagnosis. The support checks that can be made among other are: 1. Blood lab checks, among others; 2. Stroke or blood laboratory examination. Doctor can see some things that can help with diagnosis, such as excessive red blood cell enhancement. 3. Increases percent of red blood cells or extensive Hb increases. 5. Low levels of erythropoietin hormone. 6. Aspiration and biopsy of bone marrow. 7. Gen check. 8. Gen checking is done to find out the presence of or absence of gen mutation that cause the occurrence of Vera polycythemia. 9. Cause and risk factor of polycythemia vera. The cause of Vera polycythemia is malignancy or cancer, which is in the myeloproliferative group. This occurs when genetic mutation in genes the serves to control both cell production, whereas the cause of his genetic mutation remains unknown today. It is worth noting that his immune disease was not passed down through parents to his son. Felixomania can occur at any age, but most often appear in adults for the age of 16 old. Handling of Vera polycythemia. Felixomania is an incurable chronic condition. The handling done is focused on reducing the number of blood cells located within the body in the contractor, in order to lower the risk of complications that can result from the disease. Our work blood handling can be to both stroke the vein, low dose analgesic drug consumption, The consumption of the drug deteriorates the ability of bone marrow in producing blood cells. Chemotherapy. Therapy for removing existing tested and like the consumption of anti-liquid drugs. Preventive of Vera Polisitemia. Prevention of the disease is a robust canon still unknown, resulting from the cause of the still unknown mutation of the gene.